notes, because there's a team there that actually will end up the practice performance will drop. There's also a workplace mistakes, accidents and injuries, and then higher absenteeism and staff turnover. You may find that this is going to have a risk to your patients. So we've gone through all the things that we need to when it comes to understanding it. Now, what can we do? Let's go for some things we can do, right? First of all, you have two parts to this. The first part is what you need to do for yourself. Understand your anxiety. Keep a diary of your anxiety. What makes it better and what makes it worse? And challenge that anxiety. Challenge the thought. Understand what the thought is saying to you. Your unconscious is trying to tell you something. And by understanding the meaning and giving it a voice, you can reframe it and release the anxiety that's attached to it. This is mostly what I do with my clinic, with my clients. So it's really about, you don't have to live with an intrusive thought. It's trying to tell you something, and it's really important actually to listen. Make time for worries. We all rush through life and think, yeah, I'll do it tomorrow. I'll do it tomorrow. You have to prioritize you. To help you understand your worries and their meanings, you need to spend time working on yourself. Once you understand the cause, you can start to build in a self-care plan. Find ways to refocus. Shift your focus. After taking time out, focus on what is going well. So you're working to shift your focus from what you can't control to what you can control. So you need to work on a self-care plan. And that means identifying activities and practices that promote relaxation, mindfulness, and emotional well-being in you. Focus on activities such as regular exercise, deep breathing, and setting those healthy boundaries. Saying no instead of saying yes every time. Talk to someone. Suffering alone prolongs the experience. So speak to trusted friends and seek out a cognitive professional like myself who can be a guide to help you to understand why you feel this way and help with techniques to support self-care and recovery. Breathing techniques. I can't tell you how important breathing is. I mean, I know it sounds pretty obvious, but slowing down your breathing, especially on your exhale, slows down your heart. And this induces the parasympathetic nervous system, which helps you calm down in the moment. This brings a balance between your unconscious and your conscious brain, brings in this area of clarity, gets rid of the cloud. Don't leave it. Just like dentistry, the sooner you recognize and treat, the sooner you will feel more resilience and leading to a happier life. Just like we saw the blood coming out the eye, you can't leave it. Practice mindfulness. Practice mindfulness helps reduce anxiety, stress by encouraging focus on the present moment, living in the moment like we do when we were children. These techniques are things like meditation, deep breathing, and grounding exercises. Again, this can really help you to focus on what you can control. One thing to say here is if you have ADHD, and I have quite a few clients that do have that, I try and get people to do 3 things at once. And I have a son like that. So he might have to listen to music, focus on something else while he's just able to live in that moment. So it does make a difference with a neurodiversity. Reduce negative self-talk. How many people on this call today are always talking themselves down, putting themselves down before they talk about somebody else? We are our own worst enemies. Reducing negative self-talk involves understanding and challenging those unhelpful thoughts, reframing them with positive affirmations, and practicing self-compassion to build a healthier mindset. Get support. I can't tell you how important it is to just get someone to help you, including working with therapists like myself, or joining the self-help groups, speaking to just a friend or a colleague. This is where your mental health champion, and I know that Maria is looking to build out that. If you have in your practice somebody who has the skills, who would be really good at listening, identifying, and signposting. You don't necessarily have to be a therapist to be a well-being champion. What you really need to be thinking about is having someone with the trained skills in order to recognize, listen, and signpost. So talking of teams now, what can we do about handling stress in a team? First of all, we just talked about the wellbeing champion. So promote open communication is really important. That regular team check-in. So just in case somebody doesn't feel confident to come to you saying they have a problem, if you have regular team check-ins or meetings where your employees can openly share challenges and support one another, this helps to focus on building that safe, judgment-free environment to talk. Team building activities. Have you thought about getting your team together outside of work, spending time in non-work related activities? This can help your team bond over shared experiences. This can lead to better understanding and better communication. Building more tolerance and understanding of each other's jobs. You know, they're working in different areas. What do you currently do? Think of fun, low pressure events such as regular outings, meals out, or activities that get the team working together. I like the idea of actually swapping teams that do not work together regularly and giving them activities. I don't know whether you have them in your area, like escape rooms, trivia games, or outdoor team building exercises. These are great ways of mixing up teams that don't currently work together, and that helps build stronger bonds back in the surgery. I say foster a positive work environment. That really means that a person needs to be valued. We all like to feel valued, whether we are at home or at work. So a positive work environment is about valuing a team, making them engaged and motivated. And that's where you think about things like recognition and appreciation. Celebrate the team's achievements in individual contributions. Do you promote a work-life balance in your practice? If you're working still, then probably is a problem there. Think about offering that flexible scheduling. So if you are going to work till 10:30 at night or 11, then start a bit later so that people can have a work-life balance, encouraging breaks, creating more support and a stress-free environment. What about providing and support of resources? What about access to mental health resources? Do you have employer assistant programs? These things are about therapy and counseling services, or even a stress management workshop like this. So think about what you're offering right now. And I'm going to mention again the wellbeing champion, training up one of your team or more with those skills to set and identify early signs of stress and anxiety. That's a guide to signpost team members to appropriate support systems. So they just have a list of, you know, yes, you need to have a call with this person. You need to have a call with that person. And access to therapy and counseling. Seeing a counselor and therapist does not mean you're broken. All the clients that come through the door are much stronger than you think. It's really about equipping your team with effective coping strategies. So we just need to have more resilience in our team, and that's what we're going to talk about in a minute. So we want to create this safe and private process for the team to request support and regularly remind them of available mental health resources. Recognizing achievements. As we mentioned earlier, celebrate your team's achievements, such as meeting patient care goals or handling challenging cases. What about a recognition program like Employee of the Month? Or provide small rewards to acknowledge individuals and team contributions. Encourage breaks. When was the last time you had a lunch? Remember, high emotions make us stupid. What it means is it's so important to take a moment to switch off, because when you're stressed, your brain's amygdala activates the flight, fright, and freeze response, which floods the body with cortisol and adrenaline, which is your negative hormones. This surge diverts energy from the prefrontal cortex, which is responsible for logical thinking. This reduces your ability to think clearly. So taking a moment to switch off can help you absolutely recharge and stay focused. Even 5 or 10 minute breaks, but full lunch breaks are fantastic. And just walking outdoors for 5 or 10 minutes can make a difference to thinking clearly. And after all, what we're doing in clinical, we really want to be thinking clearly. Peer support. A problem aired is a problem shared, is the old saying my parents used to say. So regular check-ins on each other, a buddy system, and open communication. Just that team building activities, and just popping in to say, you had a difficult case today, is everything okay? So these are some ideas. Obviously, we only have an hour today, so this is just a really overview of what you want to do. But what I will say is the biggest part is prevention is better than cure. So coming back from burnout, and I know Maria will say her story later, is notoriously hard. It's simply very difficult and you're going to suffer with very difficult conditions. So you want to really think about improving sleep, eating, exercise. These can help relieve the symptoms, but they won't fix the problem. So what we need to look at is on an organizational level, there are a number of things we can do to prevent your team from burning out in the first place. So the next quick section we want to talk about here is stigma. And mental health affects millions of people and are both a common and treatable. But despite this, stigma is all around us and can prevent some people from talking to somebody. The stigma often stems from outdated beliefs, and they think that seeking a therapist is a sign of weakness, but actually it's in reality a sign of strength. When my clients come through the door, this is a courageous and proactive step. So what is mental health to you? I'm sure you've all suffered from some kind of anxiety and stress in your life, or you know someone that has. Mental health refers to all aspects of a healthy mind. In other words, how we think, feel, and act. The stigma surrounding mental health differs across generations and different countries. Older generations feeling it is a personal weakness and therefore not to be discussed, while younger generations, like my children in their 20s, tend to be more open and advocating for this mental health awareness. And they seek help more often, pushing for mental health to be prioritized as part of their overall well-being. But it doesn't help with the media, because news outlets overly sensationalized stories involving mental health, focusing on the extreme cases rather than everyday experience. Additionally, social media can spread harmful stereotypes. So it's really important that we understand and break some of this stigma. So to overcome this stigma, really is important to start educating, talking, conversations. This should be really normalized. This should be an everyday condition, and we talk about it. For example, just like visiting the dentist for a toothache, seeking help for mental health should be seen as a normal, healthy response, not something to be ashamed of. We easily chat with friends about dental appointments, sharing experiences and showing empathy, but rarely do we openly discuss seeing a therapist. Yet our brains control every aspect of our lives, making mental health just as important, if not more so, to talk about. Mental health professionals are trained to provide support and treatment for a range of mental health issues, and seeking our help can be a powerful step to recovery, healing, and thriving. So really, again, seek help is a courageous and positive step. We really want to normalize talking about your mental health. Your brain manages every aspect of your life, and yet we'll talk about our bodies. If you went to the gym, you would have a guide talking to you about what you want in your body. But when it comes to your brain, we don't talk about it. There is something wrong in that situation, and we need to break down those barriers. Why does stigma exist in the healthcare profession? We think it's really down to this facade of competence and resilience. There's a fear of judgment and a concern about professional reputation or career consequences. This can discourage showing our vulnerable side or seeking help. So what we need to do is normalize it. We need to normalize talking about mental health as a healthy part of self-care. Just like going to the doctor when you are physically unwell, it's about creating an environment where asking for support is seen as a sign of strength, not weakness. And really, again, the team, practice managers, need to encourage openness by fostering this supportive environment we talked about earlier, embracing the vulnerability, as well as actively listening without judgment. Again, this is back to your well-being champion, but we need to think about, why does it exist, normalize it, and talk about it. For example, if you had a conversation, you might think it might go a little bit like this. First of all, people may think I cannot cope. Nobody will understand me. My employer might get rid of me. I am a failure if I admit to struggling. Why can't someone just reach out to help me? Nobody cares about me. Whereas the colleague wanting to help can also be confused. I may make them worse. If they get worse, it will be my fault. I don't have the skills. Remember, that well-being champion doesn't need the skills. What if I give the wrong advice? What if they think I'm prying? I don't have the answers to help or support. So you can see why we need to have training for the team, because actually all these things really are really a facade of really what's happening. So people really need to be able to have a wellbeing champion or trained team in order to say, that's okay. It doesn't matter that you're feeling this way. How do we put it right? How can I help you? What services and support mechanisms can I support you with? So really, it's about communication. Open communication reduces the stigma about mental health, making it easier for the team members to share concerns without that fear of being judged. You need honest, empathetic conversations to foster this culture of trust and support and encourage this two-way communication to strengthen these connections. And what we need to look at is, how do we build this resilient team? So the third thing in our presentation tonight is building a resilient team, because it's not about avoiding challenges, it's about equipping teams to push through them. Don't forget, if you have any questions, just put them all in the chat. We'll have plenty of time for questions at the end here. So if you have anything that's resonating here and you want to talk to us at the end, I'm excited to hear from you. So what is a resilient team? Well, first of all, the definition of a resilient team is the ability of a team to recover quickly from challenges, adapt to change, and continue thriving in a demanding environment. Sounds familiar? Let's see if you recognize some of these attributes in your team. So first of all, you need adaptability. Think about how adaptable your team are with new challenges. Are you flexible with open mindsets? How good is your team at supporting each other through change? Second part is really collaboration. Think about open communication, trust, and mutual respect with all your team members, dentists, hygienists, assistants, and all the team. They all share skills and perspectives and work towards common goals to solve problems together, all with the primary focus of providing the best possible care to your patients. And finally, big word, trust. This is the foundation of a resilient team. Think about cultivating honesty, relying on and supporting each other, where your team members feel comfortable sharing ideas and admitting any mistakes. Again, you have to understand that that is actually how you learn. A place where you feel psychologically safe to say anything and be able to have open communication. This in turn will build stronger team relationships to help you navigate the many challenges that I know you face every day, but with confidence. So what do we do? How do we do that? First of all, we need to strengthen the communication. Think about creating a culture of both open dialogue and active listening. That's a big difference, okay? It's not just about talking, it's about listening, where all your team members feel comfortable sharing their thoughts in a safe, judgment-free space. How about scheduling regular meetings with the team to discuss workflows, share successes, and address challenges? Include that quick check-in I mentioned earlier or debrief to identify stress points from both work and home and ensure everyone feels supportive. We mentioned this supportive environment. This is, again, the environment where you feel respected and valued and heard. Respected, valued, and heard. Recognize the contributions of everyone and celebrate their successes. That boosts morale. Promote teamwork by supporting each other during busy periods, which is really important. If you've got clinical tasks and patient flows, you want to be able to get teams to work on that together. Small gestures like check-ins after tough cases. You know, sometimes if you've really been on a tough case, it's nice to have someone put their head around the door and just say, are you okay? And this could mean you need extra training, which is where Maria will come in. She's got a fantastic program here that can really help you when it comes to training. So benefits of a resilient team. The most important thing is improved performance. Your resilient team creates a seamless workflow. They thrive under pressure. They adapt to everyday challenges. They manage stress effectively. They have the ability to quickly reorganize schedules when you've got a patient that's come in last minute, and they can communicate effectively. They're better at problem solving. This team will deliver great patient care and smooth workflow efficiency. They stay calm, they're solution focused, they collaborate as a team, they adapt for treatment plans, as we mentioned earlier, and they learn from challenges. They've got higher job satisfaction. Go figure, huh? Your resilient team will give you more loyalty and better patient care. This is a team that trusts you and has open communication, enjoys professional, personal growth, has a healthy work-life balance. Remember that. Make sure they have some of that, and supporting well-being. And again, this work, it's all about your workplace culture, really. You know, this culture is about building a resilient and motivated dental team that delivers exceptional patient care, and your patients will notice it. So this creates a warming, welcoming environment, offering mentorship opportunities, encouraging open communication, building team collaboration, boosting morale, and fostering that teamwork. So really, it's about positive outcomes for everyone. So how do the patients love this? A patient loves this resilient team. They can feel it as they walk into your practice. It's basically where they feel they are trusting you. This team is really good at fitting in emergency appointments without throwing off the schedule. They communicate better to the patient. They manage stress more effectively. And a result, that patient is happier and more relaxed, especially if they're nervous. How's a team going to manage? This team that is resilient with clear roles and ongoing training, they naturally boost that feeling of job satisfaction and confidence, making everyone more productive with career growth and resulting in less turnover. Going to keep your team, basically. And obviously you're going to have this greater work-life balance, but also for yourself as a practice owner. And Maria will say this as well. You work, and you just keep focusing on it, then eventually there's a burnout. So practice owners that delegate and empower their team better can reduce their own workload and gain more time for strategic growth and personal well-being, and again, more time with their families. So as you can see from these stats, higher productivity, lower absenteeism. So you've got 21% increase in productivity and 41% decrease in absenteeism by having this better, more resilient team in a strong culture. But it really does make a difference if the top person, if your practice manager, practice owner, has to walk the walk, not just talk the talk. So leaders have to lead by example. And so that is me done today. Thank you for listening. I do have a last minute slide that we'll go through in a minute, which is about our thing. But I'm going to hand back to Maria now for any questions and any feedback.
Yeah, okay. So thank you so much for the presentation. Actually, I would like to start asking a few questions, and perhaps maybe somebody also from the audience, if they can put it in the chat, or they can share their thoughts on this. But to make it to make the beginning, I would like to ask in the beginning. You said a lot about the team resilience. So if you discover somebody in the team, let's say that it has the symptoms and she or he doesn't feel very well, so what would you do to help him?
Well, first of all, I think it's really important that there's two parts here. Some people may come to you and say, I'm not feeling very good. And that will be all those symptoms we talked about, behavior, emotional behavior. There's a change in their interpersonal relationships. And that's easier because you can then pull them to one side. You need to, first of all, listen. It could be they just need to hear somebody, or they may need to just hear that there's someone there to support them. You don't necessarily have to have the skills in order to help them, but that's where you need a signposting, so that you can have, there's a phone number for a therapist, there's a phone number for a counselor, there's a phone number for a GP. It could be there's a health thing. It could even be a financial situation. So until you know what's going on, you can't do anything. But there's also an aspect where we talked about the wellbeing champion that actually recognizes things, because some people don't talk about it. With the stigma, they don't talk about it. So again, I think it's really important that you actually have regular check-ins with all your team, so that you're having a once a week check-in every team member. How's it been this week? Everything okay at home? Are you coping? Is everything? Are you sleeping well? Just a little checklist to see whether you're going to be picking up some of those symptoms. But then the answer is really observe, listen, signpost. The signposting is key, because people at that point, if they have high emotions, they can't think clearly. So picking up the phone and speaking to somebody is one step too far. So I would say in the team, you would need to have this person that would able to be, I'm going to make you an appointment. This is a very good therapist. That person can help you out. And once they've gone down that journey, they will be fine because they will be with a professional that understands their situation, if that makes sense.
So you mean that we have to make, let's say, a list of professionals that could help our team or ourselves, let's say, just in case, just, you know, as we have the, let's say, the cardiologist or I don't know what other specialty, we should have also a list of people that could help us on the mental health issues.
Absolutely.
Exactly.
And what's causing the mental health? Because it could be that somebody is, you know, there's a problem financially at home. So it doesn't always, but, you know, you might need more than one professional. You may need, I mean, I work with a lot of people who are going through divorce. I will signpost them to somebody who can help them understand financial planning. But for me, I will work on their anxiety. So you might find more than one professional is what you need rather than one person.
Yeah. And how do you think we can, let's say, surpass the stigma? You mentioned it before, and it's quite a problem, actually, because also the World Health Organization is saying to us that burnout and professional exhaustion is part of a disability. So how can we do that?
I think the word I would say is normalize. And it's really important to build out some of this structure that we put in today in the presentation so that, you know, we actually talk about our mental health. And it has to come from the top. People have to change from the top. So, you know, it's building out a structure of having regular meetings, talking about mental health and, you know, being open and honest. You know, we opened the meeting today with you saying that you've had burnout. So it doesn't become you know, actually, there's a lot of skills that you learn in your journey on burnout. Whether it's obviously there are effects that go through your body, and you have to, you know, you get to a point where you can't work. But when you do climb back out, you become a stronger person. So during that journey, you might sort of adjust the way you see things. It's more your priorities change. So there's a whole journey on this. And I think what we need to do is talk about this more, make it more of an everyday conversation, and build in regular checks so that people do not feel that, you know, you go and see the dentist, for example, you walk into your practice and you say, oh, went to see the dentist today. Oh, what did you have? I had a filling. Let me tell you my filling story. Everyone's got a filling story or having a crown done. But we don't go in and say, I went to see my mental health support. You know, why not? Because the brain is managing the whole body. And it's the same as you went to the gym. If you went to the gym and you decided you wanted to get a better body, you would go in and you would find an instructor. And the instructor would say, what do you want from the gym? And then the gym would say, okay, I want a better muscle. I want more stamina. There's no different between that and me going in and saying, what do you want from your brain? What do you want to leave behind? What isn't useful? What are you carrying? Why? You know, why people are picking up these bags of anxiety and hanging on to them. So I think it's about making it an everyday conversation, putting the brain back in the body.
And discuss more about the issue. Discuss about it. Don't just hide it around. So let's say if we have young dentists now, they are starting, or maybe at the last year of their studies, our students, what would you say to them? What advice would you give them to start from now that they are early in the profession?
Absolutely. I would say there's one word that's really key, and that's resilience. You are going to, just imagine you're going on a journey at the moment, and there's going to be things that will knock you off this path. It's just natural. Normal life knocks you off the path. So building resilient tools in order to get back on that path is key. Because, you know, I had my son's girlfriend went for an interview and she didn't get it, and she was going to stop. That was it. The world was coming to an end. And I said, what didn't you get right? What didn't you get wrong? Let's build on that. Let's build resilience. And that's where younger people now realize that actually that's what's going to hold them through life, is building out resilience, looking at the tools in order for them to realize that you are going to have days that aren't going to be perfect. There are going to be difficult things, and building out tools to get you back on the path more quickly so that you're not feeling like the world is coming to an end. So it's that resilience, I would say, and that's where training is really important. Sometimes you have fantastic parenting and they give you resilient tools, but others, aren't as lucky as that. And so, that's where the training, Maria, that you do is building out the resilience in a team. People might have to learn these skills, even in their teens, 20s, 30s. You're never too late to learn new skills.
And it's better to learn them quite early in their life, not to wait to go 50 years old.
Yes,
huh?
Yes.
Yeah.
And also I would say one other thing for younger people is not to, to put their hand up when they feel they need help early, not to leave it. I think if you leave it, it becomes a bigger issue. Whereas if you say that, and it's never too many times to say I need help. So actually, that's part of learning resilience. Because if you put your hand up and say I need some help, it could be on a worry on this or this or this. You may not have to have that hand up next time because you've learned something from it. So as long as you're learning from it, the next time you go, hang on, I coped with that differently last time. So all of these skills grow and then you become this resilient person. You're not born with resilience. That's a learned experience.
You build one step over the other, and you stay less time in this situation. And that is the key. That is the key. Okay, you mentioned before a lot of tools that we could use. What do you think somebody who is just starting to feeling all these issues could start doing?
Yeah, I think the first thing is to understand writing down how you feel, because I think sometimes, first of all, talk to somebody or write it down, get it out, because something is basically making you feel anxious. So you can start with what's making it worse, what's making it better. This is how I work with my clients. When they first come in the door, we sit and we say, what is this feeling preventing you doing? And often it's like, well, I feel I can't, maybe it's a social anxiety and I don't feel comfortable talking to this group of people, but I'm okay with that kind of person. So what we need to do is understand what's going on. Once we understand where it's coming from, most of anxiety comes from childhood, whereas stress is a natural process. Okay, that's why I was trying to explain those two. So I would say the first of all is talk to somebody. It may be by just actually talking to somebody, that's enough to realize that because some people who are working with me, as the more they talk, the more they actually have already got, everyone's got the skills already inside them. The tools are there. It's accessing the tools. So as they talk, they go, I can do this. And that's where the confidence builds.
Yeah, we know how to survive, but we need somebody to just tease us and see the whole truth. Yeah, a guide. And how do you
go on after you?
Yeah, how do you think we can change this mindset? I mean, do you think it's easy? How hard could it be?
I think it depends on the generation. I would never even dream of changing the mindset of my late parents, because they were ex-war, and as far as they were concerned, you're alive, so get over it, pull yourself together. But I think it depends on the generation, and also it's really important to treat women differently to men. I think there's a big stigma again on men's mental health, that you're supposed to be the strong provider and therefore you're not supposed to be weak. And also I think we built this into women in dentistry, because we have to be mothers, we have to be partners, we've got to be practice owners, we've got to be mentors. And so if we've got a weakness ourselves, in our head it's weakness, we feel we can't talk about it, but actually it's where the empowerment is. And I often say to my children, I'm struggling, and they go, okay, how can I help you, Mum? I'm empowering them to help me. So actually I think it's really important that we don't think of feeling low or not having a high happiness scale on a day is actually something that is normal. We need to normalize that you're going to have a low moment. And if it's just a low moment and you can pick yourself up, fine. But if it stays too low, then you have a toolbox, mindfulness, stay in the moment, breathing techniques, understand that, exercise. Now, you go for a run and you come back and you feel a different person because you've reduced that anxiety. You've switched the negative hormones to positive hormones by just going for a run.
More
So,
positivity.
Many different ways, whatever works for you, really. Also, I mean, some people would say, running is the worst thing in the world, but go for a walk along the beach. Look at the the spring flowers.
Listen to music or sing or whatever. Yeah.
Yes. And talk to somebody.
Talk to somebody. Yeah, I think that's the key point of your presentation, that we have to be more open, okay, and discuss more. And also, I gather this peer team. I also say that to my classes, that we have to have around us persons that, can support us. That we can take out the phone and say whatever happens to us, and we have always to let's say, empower this team. Okay.
And I think going back to what you were saying earlier, Maria, as well, is that, we need to find team members that have certain empathetic skills, teach them listening skills, because when you say pick up the phone, if you pick up the phone to the wrong person who's going to add their burden to yours, these people, you talk to them about something and they say, oh, I've been through that. And then you hear all their story. So actually, that's not the right person, because what you want is someone, it doesn't matter about whether they've been through it and they understand. They have to just listen to you. You need to actually get this out. It needs to come out of you. And then it's okay. Now we'll find a way. And it's almost like, let it all come out, whether it be with tears or not. Get it all out. And then, right, now we're going to find you a path. Is it this path, or a combination of those?
Yeah. And let's say if somebody has a question about that, or maybe our audience could write in the chat what they gather out of this and what they could do differently tomorrow when they go back to their office. That would be nice to hear. We have some thanks here in the chat. Okay, that is really nice of you, and it's nice that you stayed all along. It's a long day, and hopefully we couldn't find a better hour. I mean, all hours are, quite heavy for a dentist, and so it's quite difficult to find an hour to make a webinar.
It is, and I really appreciate everybody staying late tonight. We have a female dentist self-care and well-being event in May, which here is the QR code, and I will come over, and there is many amazing speakers here to talk about, women's mental health.
Only for women.
Balance. Absolutely, only for women. So please do book on, because I think it's going to be a really good event. And looking at the speaker list, it
will be nice to have you also here in Athens and see you.
Absolutely, I'm looking forward to it. Yes, absolutely.
And we're going to do a lot of stuff on this, and we are going to continue discussing about the matter, because I think now it's the beginning of a long way we have in front of us, and to sensitize, let's say, somehow the dental community about this matter.
Absolutely.
Make it more open, make ourselves, less prone to, stigma and all this sort of stuff.
Absolutely.
So we have actually a question here. You could discuss a little bit. You underlined the importance of prevention regarding burnout. But when this happens, what shall one do to get back to work? And what is the role of the medical team in such a case?
Yeah, so burnout is a tough one. If you're completely in burnout, it. You have zero energy, and it's not a quick fix. I'm going to be honest, and I think Maria, you can be honest as well.
I know that it took me 1 year to go back to my physical situation, let's say, and I had a lot of inflammation. My body was aching all over. The whole symptoms you discussed before, I had them.
Absolutely. And so the prevention is better. I mean, obviously, if you are in burnout, first of all, you need to absolutely get medical help, because I think, and you need to step away. You can't keep trying to continue as you were.
Yeah, exactly. That's I think what most of us are doing, that we keep on doing like as if nothing happens.
What is that Einstein saying, isn't it? Doing the same thing over and over again and expecting a different result. And that is the problem, is that what we do is, and I'm going to say, I don't know whether the person who put it in the chat is a woman, but we often feel we have a burden at home. I have a 21-year-old and 20-year-old yesterday. So, you know, there's a burden in it's a gift and a burden. In that you've got to sort of like, you know, and so it doesn't matter what age your children are. You know, I've been a working mum all my life, it feels like anyway. And so, you know, managing all these different aspects of it at the same time is a practice owner, and you've got people coming to you who and you've got your patients. So you do need to have a moment where you can just focus on that. Literally, you know, almost, I'm looking at it at the moment, you can put your peripheral vision, looking into your peripheral vision, so you're almost letting your eyes relax. Breathing techniques, if you're doing a breathing technique, if you focus on breathing in for sort of 4 or 5, but breathe out for 6 and 7. So what you want to try and do is to induce your sympathetic nervous system. You breathe out sort of longer than you breathe in. Some of my ADHD clients, I do box breathing, so you're breathing in and they actually draw it, breathing in for 4, hold for 4, out for 4, hold for 4, and they draw these boxes because it helps them to do 2 things at once. So understand what's causing the burnout. You know, burnout is often high performers have burnout, which means they could be having a limiting belief. For example, in their childhood, they had a parent that when they came home from school with 98%, the parent said, "What did you get wrong?" The rest of their life, they are focusing on what they get wrong, and they are trying to fix that by putting more on their plate. Let me fix it, because they don't get the satisfaction of what goes right. So somebody like that is saying yes rather than no. And eventually there's burnout because they become a yes person. Over the years, I'll do that. Yes, I can do it. Yes, I can do it. And eventually there's, you know, the body gives up. So it's working out why you're getting down this route, changing that route, changing the path, talking to somebody, delegating if you're a practice owner.
Step back a little bit. Step back a little bit. Give yourself some space, some time, you know, to relax more. That's really important, I think. So okay, so we can stop here, wishing that we could have more time to discuss on the matter, but I think we can organize something even after May. Of course, May, you are going to be here with us, but I'm saying that maybe we could do another webinar and discuss maybe some tools.
Maybe in the chat, if anybody has any ideas of what they want to hear on a webinar.
No, that would be nice. So you can make some notes, or otherwise I will send you in the email some information, and then you can send us a feedback on how and what else you would like to know about this matter. Anyway, so I would like to thank you very much for being with us today. Also, our colleagues here. We have also somebody from Bucharest, Faculty of Dentistry. That's really nice. Really nice. Thank you so much. And we're going to do that again and spread the word to the dental community, because I think now it's the point and the whole thing that we can do. Okay. We have a comment here I would like to read. I want to emphasize how crucial it is for new dentists and dental students to have professors who address stress and stress management, demonstrate empathy and understanding, and possess deep knowledge of the topics discussed tonight. Dentistry isn't just about building a strong team within a clinic. It starts in dental school. That's a very good point, actually, which should be seen as one united dental team, where we support and uplift each other. That's really nice. I hope everybody could see it like that in the dental school and in big clinics, I mean, like that. Thank you for the comment. And also here, I am a dental technician, and I would like to hear about cooperation in the team. And how you can.
And I think Yeah, so as a dental technician, the important part is, do you work a lot on your own? Are you in a station and spend a lot of time on your own? Going back to building out that team activities, even if it's basically, I have a lot of friends who are dental technicians, and they take different breaks. They go in, and you can be quite lonely in that role, because you're in all day long, and you actually, apart from passing people in the lab, so it's really important to actually build out even activities where you have a 10-minute sort of like round the table, even discussing the work, even if you feel you've got to discuss the work, building that cooperation. But it does come from management. You need to build in those actual actions. And if you are able to influence management, and I will say one thing that's key here is, if you can do external activities, even if it's on a weekend, go and do a family football game, or go and do something where you go on a boat, or you go away, and it doesn't have to cost a lot of money, but it just means that doing team activities where you've got a lab technician working with, maybe you've got the sort of Crown and Bridge working, who don't actually see each other every day, because they might pass each other. If it's a big lab, you're passing each other, and again, there's isolation, and I'm sure that there's isolation in your lab. So changing that needs to change from the core. It needs to understand that I even have in my head, walk in your shoes, so that actually you basically, maybe you team up a buddy system where you actually, both work on a project for a bit, so that you just get some support.
That's a good idea, actually. The body thing. Have a buddy always. I mean, even if you work in a dental office, even if you work in a university, it's nice to have a buddy. A very strong, collaborator. That's a good idea, actually. And
just put my light on because it's getting dark here now.
Exactly.
Okay. So I think that a buddy system is great, because it means that you can say, look, actually, and again, building out a well-being champion, building out, look at that slide that had the benefits. You get higher job satisfaction, lower absenteeism. It's a family. You're working long hours in a family. So if you have a family where nobody eats together, people don't talk to each other, it's a dysfunctional family. So why are you not doing the same at work? You might just need to actually bring in, cakes once a week, and just sit down and everybody have a story from the week. What's your best story of the week? But I like the idea of getting out of the office, if you can, or out of the lab. At least pick somebody and just once a month, even if it's once a month, and also healthy competition. So you even have a competition that's running through the lab. It doesn't always be about work. It could be about, something different. And in the UK, we have these things called pub quizzes. People go to there's a quiz. And so just
something they can think a lot of. If we make a brainstorming here, we could think a lot of ideas that could run around in between the days.
Yes, it's got to be practical. It's got to be reasonable. But you might just find that at least if people are having breaks, they have to have them in pairs, so that each week I'm paired with you this week for lunch breaks. So we're going to have lunch breaks, and you sit together. And next week I'm paired with that one, and that way round you are just But a lab it can be isolating, and so a competition might cause a lot of stress if it is. I get that. So but I make it a fun competition. You know what I mean? It's not about work. It's more about quizzes.
Quizzes.
One of the things we did in the pandemic. We did quizzes on music or something like that. So it's a running competition.
To relax and to have the mind somewhere else to think different things and this sort of stuff.
Not about the lab.
I think we have to make another webinar on these tools we can use in the teams. Absolutely. Teams, big teams, university teams. We also need that. Because we miss each other. We don't know what the other one, the colleague next to us, is doing. His interest, her interest. We don't know them, actually, and that is really very uncomfortable.
Yeah,
very uncomfortable.
that's a very good idea. And that's why the buddy system is quite good, because actually by, just actually being paired to somebody you don't normally sit with, so that you actually, and finding out about each other is very useful. I think it's normalizing talking. It's getting to, if you think of it as a family, you're there as long as you would be with your own family. So why are you not spending time to put in structure that allows you to feel comfortable and at home?
Exactly. Yeah. And of course, lunch breaks. Here in Greece, we don't have it. It's not a very common habit, but we should do that.
Yeah, and I think if you build out, as I said earlier, if you're highly stressed and you're not switching off, eventually your brain doesn't work, because you can't have high stress and clarity in your brain. It doesn't work. So if you don't have a break, and even if you are able to sit outside the practice for a few minutes, I mean, I have some amazing practices I work with that have beautiful gardens. They built a beautiful garden with loads of lovely plants. It just feels nice out there. And they encourage their team to go and sit in the garden, even if it's 5 minutes or so, get breaks in there.
Yeah. Just take some fresh air. Yeah.
Being with nature is really important. So actually just getting away, sitting back for 2 seconds, or take a book to work for those few minutes, just a novel, something completely different to work. And you just switch into a different world, because your brain switches into another place. When you come back, you'll be so much clearer, because your brain has had time to just sort of almost decompress, defragment.
Exactly. Okay, so thank you all again once more. I am perfectly imperfect, so I had missed a little bit from the beginning, from the recording, but I think most of it was recorded actually. Never mind, we're going to do that again. I will send the recording to everybody. So thanks again. Thank you, Jackie, and see you in Athens, 10th of May, to speak more about this.
On here that are actually coming to that.
Women's resilience. Let's see that. Okay, good night, everybody.
Good night, everybody.